Well, hello and welcome to Raj Sabha TV. You're watching India Fights Back with the host Rajat Kain, the show which gets you all that you need to know about India's fight against COVID-19 pandemic. Well, Prime Minister Modi on Friday chaired an all-important all-party meeting where he asserted that India's scientists are very confident that a vaccine against COVID-19 would be ready in few weeks. At that time, the Prime Minister said that India's vaccination program would begin as soon as it gets a go-ahead from the scientists. Prime Minister Modi had this Sunday visited India's top vaccine hubs personally to review the developments of coronavirus vaccine and the manufacturing process. Well, in a virtual meeting today, floor leaders of both the houses of parliament, union ministers and leaders of political parties were present. Well, to discuss further on way ahead for India on COVID-19 vaccine and a fight against the pandemic, we're joined with a panel of three very important guests. Dr. Samiran Panda, he's scientist from ICMR. Dr. Madan Gopal, senior consultant health, Niti Aayog. And Dr. Gupta, former HOD, Pharmacology, from All India Institute of Medical Sciences. Well, doctors, thanks for joining us. It's very important show, one of the shows where we focus on India's fight against COVID-19 and also how are we going ahead in our battle. Well, let me start with you, Dr. Panda from ICMR. Sir, what, given Prime Minister's all-party meeting and his assurance to everyone in India that soon we'll have a vaccine. In terms of vaccine, in terms of the process, what is that? You can tell us more about it. Dr. Panda.
Well, vaccine against a disease like COVID-19, which is of great public health importance and has assumed a proportion of pandemic, that requires a couple of considerations. But the two most important considerations are the context of it in terms of the epidemiology of the disease in a particular country that builds the context and the pragmatism. A country as big as India and as populous as India would not require or would not even aim for vaccinating everybody overnight. That's impossible.
Absolutely.
However, the vaccine needs to be given probably pragmatically and also in terms of feasibility to those who have the greatest vulnerability. So vulnerability should guide vaccination program decision. And when we talk about vulnerability, it is about the risk of acquiring infection, either due to occupational positioning that one has, or social positioning, the earning of livelihoods or whatever. So these two issues are now being considered, and in all-party meeting, suggestions, I'm sure, came from all the states and the representative of people in order to be able to address these issues, which are of great programmatic importance.
Right. Well, let me move to Dr. Madan Gopal from Niti Aayog. Sir, very welcome to the show and thanks for joining us. Let me ask you one very important question here. So, given the size and the vast dynamics of Indian population and given several testing that needs to be done on the coronavirus, on any vaccine for that purpose, how big that process would be, how vast that process would be before we arrive and say, yes, we have got the vaccine?
Thanks, Rajat. As the Honorable Prime Minister has already mentioned, he is relying on the scientific committee, scientists, for arriving at a vaccine. Nevertheless, while we have a National Technical Advisory Group on Immunization, which is the more or less advising the government of India which vaccine to be included in the immunization schedule. That group has been given the task force has been given the task to identify the vaccine, and they have to suggest that which vaccine the government should go ahead. While the suggestions are awaited, while the regulatory clearances are awaited, the government has made efforts to reach out to the population and start preparing once the vaccine is there. Because if you understand the vaccination process, when the phase 3 trials happen, there's a stockpile of the vaccines also happens in the anticipation that if the trials are successful, then we are having a stockpile of the vaccine which can be immediately put to public health use. So that's one thing. In anticipation of that, the vaccine administration preparations are also being done. Second thing is, if you look at the immunization thing, we are having experience of immunizing. If you look at the immunization, that means every year we are near about 6 crore children and the women we are immunizing against all the antigens under the universal immunization program. In the Dhanush and the modified Indradhanush, we have campaigns for immunizing a large section of population in a given period of time. In a matter of months, that kind of capacities we are having. The other thing is, the other preparation, the other logistic preparation is that the cold chain, the vaccinators, the immunization schedule, who will be the beneficiaries, that exercise is already there. But the biggest question is which vaccine to administer.
Right.
One thing is that we were expecting that the Oxford vaccine would apply for emergency use authorization in UK, but they have not applied. If they would have applied last week, then it will take 2-3 weeks to get approval there. Then simultaneously we would have also applied here in the country. But that has not happened. Whenever they would be applying, you have a slack period of 2-3 weeks after that, when the vaccine can come. But the stockpile usually is a part of the game that whenever the vaccine trials are happening, a stockpile also happens. That means whenever the vaccine is approved, the infrastructure is ready, it is getting readied. That kind of preparations are happening, and once the vaccine is approved, it will be administered very quickly, at least to the priority groups like the healthcare workers, the frontline workers, and then once it comes to them, then the second phase of the vaccine administration can happen.
Right. Dr. Gupta, Dr. YK Gupta, please welcome to the show. I mean, let me ask you first question here. Sir, given the recent history of vaccinations and the pandemics, is it for the first time that we are actually arriving at a vaccine at this faster pace? Dr. Gupta, can you hear me?
There was a voice breaking. Can you repeat your question again?
Sure, sir. Sir, I was just talking about our scientific fraternity here. So in the past, we have seen that during pandemics, we usually have a long time before a candidate vaccine arrives. But here, within just an year or even lesser, we're talking about, the main vaccine arriving. So isn't it just fabulous for the scientific fraternity to say off? I know it will take some time. There will be trials and there will be other processes, but the pace itself.
I could hear you partly, and partly I will guess what question you asked.
Right, sir. Right.
I would say that this is a unique situation we are seeing in this century.
Right.
And this has told us 2-3 things. That if there is a willpower, the scientists can arise to the occasion. And this is the first time the vaccine has been developed at such a fast pace with so much of predictability and amazing. And I would say this, in Indian context, I would say this vaccine issue has taught us few things. One is it requires a complete epidemiological study, data generation, which India is very competent of. Science, how the vaccine is developed, which is efficacious, which is just free of side effect, how we can develop the predictability. And it also requires, as Dr. Samiran and Dr. Madan Gopal said, complete management package.
Yeah.
Starting from the inventing, getting medicine, storaging, getting these syringes, disposables, putting them into order, deciding priority, and also then managing wastage of syringes, needles, and so on and so forth, and also economics. That
Absolutely.
how we can make the vaccine affordable, and then coordination between the center and the state government.
Yeah. We'll
Most
come to that for
important
sure.
thing
Yeah.
is, what important thing here is this all requires is political will.
Yeah.
Our Prime Minister has shown that how much confidence he has in our scientists. His
Absolutely.
personal visit to three vaccine manufacturers shows how much political commitment he has, and that is what is leads to public cooperation to such an important thing.
Right.
So I would
very,
say
yeah.
the epidemiology, the science, the management, the political will, and the public cooperation. If I say these are the five pentagon of the COVID management by vaccine, the classical example, never before in history.
Right. That's an extremely valid point, sir. And certainly the fight against COVID-19 pandemic has been a collective effort. Well, Dr. Samiran Panda, you're representing an organization which has been at the forefront in a fight against this pandemic. Let me ask you one question here about the coordination between the states and centers. We have seen that there has been a fabulous coordination between state and centers in terms of fighting this battle. As we envisage a way ahead with the vaccine, so how states and center coordination is prepared for that, and how, I mean, what do you see the coordination between two sides? How well they are coordinating, I mean to say.
Okay. Again, there was a problem in transmission, but I could figure out the most of the question that you wanted to pose.
We're sorry for transmissions. We're sorry for the audio, sir. Yeah.
No problems. The coordination between the center and the state has been witnessed by the whole country, even during the national or nationwide zero surveillance. Because drawing upon what Dr. Y.K. Gupta said, knowing the epidemiology or knowing the epidemic is so very important. Not only for knowing the disease, the extent of the spread of it, but also making certain smart decisions with regard to vaccination program. Because as the saying goes, vaccine does not prevent infection, but vaccination does. So if we need to do the vaccination in such a way that the infection stops, that's one goal. And the other goal is to reduce the impact of the disease on mortality, particularly amongst the elderly or those who have comorbidities, etc. So now, in terms of coordination, we realized that we are very much able, and that there has been a political leadership in terms of the coordination to conduct a nationwide sero survey that clearly showed that sero prevalence of SARS-CoV-2 antibody, which is a marker of exposure to infection, is actually 16% in the urban slum-dwelling population. But if one goes to urban non-slum-dwelling population, it goes half, which is 8%. And if you go farther to the periphery in a rural setting, it's 4%. So clearly, the population density differs. The chance of transmission of infection also differs, or the risk of transmission differs. So the vulnerability is different. So at the time of prioritization for vaccination, these data would come into a big play and would help in a big way in decision making. And this data was generated through a fantastic coordination between the central government and the state government machinery. And I must underline that the workforce which was there for TB, tuberculosis prevalence survey, that team was repurposed for conducting this zero survey. So I would say that the cooperation and the collaboration that the country has witnessed is unprecedented.
Absolutely.
And the same would happen. And in today's meeting, the all-party meeting under the aegis and the able leadership of Honorable Prime Minister that took place also saw similar kind of spirit and willingness for collaboration. So I do not have any iota of doubt that there would be lack of collaboration or things would fall apart. No, no way, because India has proved that the collaboration has worked, not only to know what is the extent of the problem, but also in tackling the problem by increasing the testing capacity and the other logistic issues.
Right. Well, very well summarized, Dr. Panda, about India's fight against COVID and how all the apparatus, whether it's state or the center, they're working in just one direction. Let me go off to Dr. Madan Gopal from Niti Aayog. Sir, this question is fairly hypothetical here. Once we have the vaccine, there are parallel works going on in terms of building apparatus and infrastructure for vaccination, also in terms of having a software to get the real-time information. So how well government is preparing at all the levels, not just for vaccine, but for other supplementary things as well?
You can see, Rajat, is a very interesting question, but it is not hypothetical. It's quite practical, because once we are envisaging to carry out a vaccination drive, vaccination program, we are having that experience of this Indradhanush vaccination, the universal immunization vaccination, as I mentioned earlier. Second thing, when the Honorable Prime Minister from the ramparts of the Red Fort, when he announced the vaccination, with a high-powered national expert group on vaccine administration was constituted under the chair of member Niti Aayog. And that group has been working right from the vaccine development to coordinating with all the people, as well as guiding the states how the preparations can happen. So simultaneously, vaccine development, which vaccine to be used, that all simultaneous preparations are going on. And having said this, if you look at the universal immunization program, we have it's a technology-enabled program now. After the electronic vaccine intelligence network is there, we have been riding on that platform, and now most of the states are used on that platform. And in the COVID, as mentioned in one of the press briefs by the secretary, they have already mentioned that it has been advanced to cater to the COVID requirements. They will be calling it as a COVID vaccine intelligence network. This network is tracked right from the vaccine, schedule the vaccination session, as well as the beauty of this system is already existing system which has been advanced. And it has already been put into operations. The operations are in the form of beneficiary module, which is already being collected, which has been informed in the press. That means the beneficiary information is already being collected from the public institution, the private institutions, and now they are trying to collect the information of the other priority groups. That kind of preparedness is there. Apart from that, this National Expert Vaccine Administration Group, they do have some subgroups which look after the logistics as well, how much syringes would be required, and that kind of how much capacity we are having. Already overseeing that. That group is there to oversee all the vaccine, right from syringes, right from the beneficiary, and right from the sessions. They are guiding the whole of this vaccination drive. The bigger question is which vaccination. The National Task Force, they would be, after doing due diligence and deliberation, they would be recommending some vaccine, which will be then going through the regulatory process and will come into the vaccination thing. That's the whole effort the government is making.
Right, absolutely. Professor Gupta, do you also agree that India's fight has been one of the finest ones? If we compare even with the developed countries, that our mortality rate is much lower and recovery rate is fairly higher. So what perhaps could have been the reason for having such an achievement, despite that India, or to say developing countries, have often been billed as nations having a little wanting healthcare sector, but during the pandemic, we've proven our healthcare services, we've proven our resilience, and of course the administration, machinery, and the leadership. So, I mean, what perhaps could have been the factor for this fantastic achievement?
I would say that India being on the lower side of the public awareness, education as compared to the Western world, in spite of that,
Yeah.
India has done miraculously fantastic.
Right.
The reasons are follows to me. Number one is the political will leadership, which took absolutely on time decision what to be done. Number two, the administrative machinery, bureaucratic and scientific and social setup.
Right.
So well lit, so well coordinated that when you say that this is the time of lockdown, how much cooperation we got it from public, how much administrative machinery has worked out, how much
Right.
media has supported in creating awareness. And also the timely and so enthusiastically involvement of scientists, pharmaceutical regulators and academicians in developing vaccine. And multiple 5 companies are making vaccines. And this itself gives a boost to the public, confidence to the public. And also, I would say also the contribution of our own system of medicine.
Right.
The indigenous medicines, maybe you can talk of immune boosting system which India people have taken. So these all combined have made us unique in fighting back vaccine, fighting back coronavirus a much better way than anywhere in the world. I think we are much better fighter emerged. And I would give it more credit to scientists and to the political.
Absolutely, absolutely, to the scientists and the doctors, fraternity, the health workers who led from the front and other civil administration who were actually there on the ground during the lockdown. Right, right, absolutely, sir. Well, before we close, last word from Dr. Samiran Panda, one of the pioneer finest agencies of India in the medical fraternity and the biotech research. Sir, as both our panelists have put up that India's fight against COVID-19 pandemic, or to vis-a-vis or comparing with other developed countries, has been miraculously better. Is it also, or was it also a huge challenge before ICMR, something of never before scale? So,
yes, absolutely. While ICMR is the apex biomedical research institute of the country, it doubled up also to act as a service providing agency in terms of scaling up the diagnostic laboratory facility. And I would also say that involvement of the people of India have been great, like those COVID survivors and COVID warriors. Without their active engagement, it would not have been possible. And the ICMR and Bharat Biotech collaboration, which led to an indigenous vaccine, also is something which we could be very proud of as Indians. And that has been a very interesting example and very bright example to the whole world. And finally, in therapeutics, the Placid trial, which is Indian trial again, contributed to the global knowledge. So for the therapeutic management of COVID-19 is concerned.
Right, right. Well, on that note, we'll leave our panelists, and thanks a lot, Dr. Samiran Panda, Dr. K. Madan Gopal, and Professor Y.K. Gupta for elucidating all the very important points and, of course, throwing a light upon Prime Minister's all-party meet and India's fight against COVID. Well, before we leave, here is a small appeal from Rajya Sabha TV to all our viewers. Please stay safe from coronavirus pandemic. Wear face masks. Keep washing your hands 20 seconds at least. Maintain physical distance 6 feet at least. Remember, these are only, or to say, smaller things to fight and defeat coronavirus. Stay safe, stay home, keep watching Rajya Sabha TV. Goodbye.